The government should give us the food that was donated. Aren't other countries giving their citizens food? What about us? There is no medicine and water is scarce. How are we supposed to protect ourselves from the coronavirus?
Well, for more on the story, let's go to Max Lawson in Nairobi. He's the head of policy on inequality at Oxfam. Welcome to Money Talks, Max. Now, tell us, we already know even the most developed countries in the world are struggling against this fight against the coronavirus. But how worried are you then for lesser developed countries, emerging economies during this pandemic?
We are extremely worried. I've been working for Oxfam for many years and I've never seen anything like this. We're talking about a global humanitarian crisis, estimates of 10, 20, 30 million people dying and many hundreds of millions of people being pushed into poverty. It's really hard to exaggerate just how serious this is for the poorest countries. And as you said in your piece, they're woefully equipped to deal with this crisis. Many of them are highly indebted, they have very weak economies, they have hundreds of millions of people living very close together in slums with very, very few healthcare systems. Often healthcare systems are basically based on whether you can afford to pay, not whether you have the need. So the vast majority of the poorest people will not be able to access treatment unless action is taken immediately. And we think things can be done. Our message as Oxfam is that, if we move quickly, we know from our experience in the crises like the fight against Ebola in West Africa, that concrete steps can be taken, that you can implement social distancing, that you can slow the spread of the virus. But we really have to act now, and we need a huge injection of funding from the richest countries for the poorest countries, because if the virus is anywhere, the virus is everywhere. So it's in everybody's interests to fight it as much in Malawi as we do in Massachusetts.
Now, Oxfam has announced a 5-point plan to tackle this crisis, calling on nations to contribute. Can you just explain to us what you're calling for exactly?
Our 5-point plan is about healthcare. So we have two messages. One is a big economic stimulus to help the poorest countries, and the other one is a 5-point plan on healthcare, and it has very concrete steps, learning from our experience on the ground fighting diseases like Ebola. We need to invest heavily in prevention. We need to make sure that healthcare is free, that it's not something you can only afford if you have money. We have situations where people are having to pay hundreds of dollars just to get tested, and testing is only available to the rich or the famous. That's never going to work. We need mass testing, mass treatment. We need 10 million new health workers around the world. We think we could invest in a new army of volunteer health workers to get out there and fight the virus. And finally, I think it's very important that we establish right now that when a vaccine is discovered, and we all hope and pray that it is discovered, that vaccine is made available for free to everyone who needs it all over the world, that it's not dominated by pharmaceutical companies, by rich nations, that it's publicly available for all. Those are the kinds of things that could be done now that would stop millions of people dying, and they have to happen within the next few weeks.
Now, given that wealthy nations are struggling to keep up with the pandemic themselves in their home countries, how hopeful are you that countries like America and those in Europe, Australia, will actually respond to this call of action?
I think the quality of our politicians is very low at the moment. I think the multilateralism, the G20 is probably at its weakest in a long time. So I think that is deeply worrying. But I also think that people can see that it's in the self-interest of rich nations to stop this virus all over the world, that they may be able to handle it in the UK and Italy, only to then re-import it from Zimbabwe or Kenya, that we need a unified global response, humanity as one. So I think that's the first point, that it's very much in their interests. I think the second point is there's been a lot of learning from the financial crisis. So what we're calling for is a doubling of health spending in the 85 poorest countries in the world. That's 3.7 billion people. Now, to double health spending, which would be a huge achievement, would only cost around about 8% of what the US, one country alone, is spending on its own fiscal stimulus. So the kinds of amounts we're talking, they're not crazy, they are possible. And there are concrete things that rich countries could do immediately. So, for instance, they could suspend the debt payments of the poorest countries for at least a year. That would be a move they could agree on tomorrow, and it would make a huge difference, because countries like Kenya, where I live, are spending more than half their budget on repaying debts. And that's money that could be paying for nurses, it could be paying for prevention, could be paying for treatment. So I think there are concrete things that can happen, and I remain hopeful that rich nations will see that it's in their interest to do so.
Okay, Max Lawson from Oxfam in Nairobi, thank you so much for your time.